Hello and welcome. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the California State Loan Repayment Program, or SLRP, informational webinar. Before we begin, we want to make sure everyone knows who this webinar is for. Today's webinar is focused on our State Loan Repayment Program, which is available to new and continuing applicants to the State Loan Repayment Program. SLRP assists with the repayment of educational loans for healthcare professionals who commit to serving in federally designated health professional shortage areas, or HPSAs, or federally qualified healthcare centers, or FQHCs. SLRP is also administered at the state level by HCAI. Quick agenda for today. You'll see I'm going to do some housekeeping and introduction to get us started off today. And then I'll hand it over to Daniela Perez, the program officer for the SLRP program. She'll talk about program updates, application process, and requirements. And then at the end, we'll have a question and answer session that will be hosted in our chat. And we will conclude from there. And lastly, before we begin, here's our housekeeping items. Number one, the webinar is hosted in Microsoft Teams. If you are not familiar with the platform, you can find the view controls and the chat feature in the menu bar at the top of your screen. Two, today the chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. Number three, the webinar will be recorded and posted on our website in approximately 7 to 10 business days, and the slide deck and the resource links that you need are posted in the chat. And you can click on those to get to them. And with that, it is my pleasure to introduce Daniela Perez, the program officer.
Thank you, Christopher. Good afternoon, everyone, and thank you for joining us today. My name is Daniela Perez, and I'm a program officer for the California State Loan Repayment Program, SLRP. I'll be walking you through the SLRP program guidelines and the application requirements. Feel free to ask any questions you may have in the chat at the end of the webinar, and we'll be responding to those questions during the Q&A. So let's go ahead and get started. The SLRP application release dates. A few important dates to note for the SLRP. The application cycle is currently open, and will be open until September 16th at 3 p.m. We will begin to notify applicants of the award decision in December. So there are a couple recent changes to the SLRP, a couple things to note for this new cycle. Most of these changes did take place during last year's cycle, but these are still some important changes to note. The most significant change is that this is a no-match cycle, meaning that no match payment is required from eligible SLRP practice sites. Since it is a no-match cycle, applicants will not be selecting their practice site from an SLRP-approved site list on the application, but instead, applicants will enter their site address, and we will verify the site's eligibility as part of the review process. Applicants will also be required to submit an employment verification form, also known as an EVF, as part of the application process. Please keep in mind that both the applicant and the site administrator will need to sign the EVF. The SLRP clinician requirements. So there are a few major points I want to emphasize. These slides are currently available on the SLRP site, and you can also find this information on our SLRP grant guide. But a few requirements to pay notice to, the first one being that you must be a U.S. citizen, U.S. born or naturalized. You must possess a current unrestricted license to practice in California. You must have no other existing commitments or service obligations to any other entity. So you cannot participate in two programs at the same time. Keep in mind that you may apply to multiple programs offered through HCAI, but if you are offered to participate in any of the programs, you will need to choose one program to participate in. You cannot participate in both. You must also be currently employed or have accepted employment at a SLRP-approved practice site. In order to be considered for an SLRP award, you must confirm that you fulfill all of the requirements on this slide. The eligible disciplines. So here are a list of eligible disciplines for the SLRP. I won't be going over each discipline right now, but please remember you can find this list on the grant guide, which will be provided to you in the chat. As a reminder, you must be currently licensed, meaning that associate positions are not considered an eligible discipline under the SLRP requirements. We will be asking for a copy of your practicing license as part of the application process. Service obligation requirements. So you may apply as either a full-time or a half-time applicant. The hours required and the award amount does differ between the two. I will review the award amount in just a moment, but to go over the major work requirements, a full-time grantee must work a minimum of 40 hours per week. Even if your workplace considers less than 40 hours to be full-time, per the SLRP requirements, you must work a minimum of 40 hours per week to be considered full-time. 32 of those hours must be spent providing direct patient care. The rest of the time may be spent in an administrative capacity or spent performing practice-related activities such as precepting and teaching. But keep in mind that no more than 8 of those hours may be spent in an administrative capacity per week. One more thing to note is that a few disciplines such as OBGYNs, pediatric dentists, geriatric servicers, and mental and behavioral health care providers are required to provide a minimum of 21 hours per week in direct patient care. They must still work a minimum of 40 hours, but only 21 of those hours need to be spent providing direct patient care. The rest may be spent in an administrative capacity. And now for half-time applicants, the grantee must work a minimum of 20 hours per week. Depending on the discipline, the grantee must work a minimum of 16 hours per week in direct patient care. No more than 4 hours may be spent in an administrative capacity or be spent performing practice-related activities. As a reminder, there are some disciplines that require less direct patient care hours. The grantee will be required to work a minimum of 11 hours per week in direct patient care instead of the 16 hours. The rest of the time may be spent in an administrative capacity. This only relates to OBGYNs, pediatric dentists, geriatric servicers, and mental and behavioral health care providers. We will be verifying that you are meeting the minimum required of hours related to your discipline when we review your application. The SLRP award amounts. One major change here is that the maximum commitment will be for 2 years. An awardee participating in a 2-year commitment as a full-time grantee may be awarded up to $50,000. For half-time grantees, the maximum award they may be awarded is $25,000, also for a 2-year commitment. In the past, there have been contracts with a 4-year commitment, but that is not the case anymore. Eligible debt. So to be considered eligible debt, these loans must be government and commercial loans obtained from qualifying lenders for undergraduate and graduate healthcare, health profession degrees. We will request that you provide us with a copy of your most recent lender statement in order to verify that your loans are in fact eligible. As a reminder, they must be educational loans. Site eligibility requirements. So in order for a site to be considered an eligible SLRP practice site, they must be a public or private, not-for-profit entity. The practice site must be an outpatient facility located in a federally designated HCAI or a FQHC. This is usually the area we get a lot of questions during the application process. If you are unsure if your site is located in a HCAI or a FQHC, you're welcome to email us at the SLRP email, which we will provide for you at the end of this presentation. You may send us the full site address, and we will let you know if it is located in a federally designated HCAI or FQHC. Grant agreement deliverables. I had mentioned EVFs earlier in the presentation. If chosen for the SLRP, grantees will be required to submit an EVF every 6 months or as requested by the program officer through the EAP to verify the hours worked and days missed. It lists that you will be submitting through the EAP, but there is a chance that that won't be the case. If there are any adjustments made, we will make sure to notify you of that. At the end of your grant agreement, you will also be required to submit documentation of payments made towards your eligible student debt. These documents should be submitted within 30 days of the grant agreement end date. So communication requirements. Please note the specified timeframes for reporting any changes. So you are to immediately notify us if you are no longer employed by the approved practice site. You are to notify us within 30 calendar days prior to making any changes to your personal information, such as a name change, mailing address change, and so forth. You will also need to let us know within 30 days if your work schedule changes that will cause you to not meet your service obligation, or if you request to switch from a full-time to half-time status. You are to notify us within 60 calendar days prior to taking a position at a new practice site or organization if you make any changes to your employment status, or if you begin a leave of absence longer than 30 days. Please note that you will be allowed to be away from the SRP approved practice site for no more than 35 workdays per service year. If you miss more than 35 workdays in a service year, we will extend your contract end date for each day of absence. Please note that this is per service year and not calendar year. The SLRP breach. If a grantee fails to start or complete their service obligation, please note that you will be required to pay any amount paid by HCAI, as well as being responsible for the number of months of obligated service not completed. The formula is stated on the slide as well as the grant guide. An important thing to note is that the amount the federal government is entitled to recover shall be no less than $31,000 plus interest, but breach penalties are typically much higher. If a grantee is breached, they will be responsible to pay the total due within 1 year of the date the grantee went into breach. We, of course, want to avoid any breach of contract, and that is why we put into place the specified timeframes for reporting any changes. If you believe you will not be able to fill your service obligation, we highly recommend you do not apply for this program, as the penalties are severe if you do not complete your service obligation. Please communicate with us if you are having any issues in completing your service obligation. Please also read the breach section in the grant guide in detail to ensure you are aware of the breach penalties. We welcome any questions you may have regarding your contract, and we are here to assist you. So we have provided you with the SLRP website link where you may access the grant guide, the application, and where you may also find our contact information. If you have any questions, please feel free to email the SLRP inbox, which is slrp@hcai.ca.gov. We highly recommend that you review the grant guide in detail, which can be found on the website link. So thank you for your time and for being here. I will pass it back to Chris to take us into the Q&A session. Thank you.
Thank you so much, Daniela. As you can see, our team has put a lot of work into this program, and we're excited that you have joined us today to learn more. We're going to transition to our question and answer session, and the chat option is now accessible in the menu bar at the top of your screen. We understand that some of you may not be able to access the chat feature in the browser version of Teams due to your organization's restrictions. Some people find that the mobile version does provide chat access. If you are still unable to access the chat feature, though, please email your questions to slrp@hcai.ca.gov. Thank you for your understanding in that. We will answer questions in the order that they are received, and we will do our best to answer all the questions that you have today. And let's get started with the questions. They're already coming in. Amanda asks, hello, if an associate becomes licensed before the closing of the application cycle, can we apply?
Yes, if you're licensed before the end of the application cycle, you can apply. Just make sure that you do have your license and that you can send or attach the license to your application, because we will be verifying that.
All right, next question. If are radiology technologists eligible to apply?
Unfortunately, for this program, they are not.
One of the things that we would suggest to do is to go look at the eligibility quiz on the HCAI website, and we'll put that link in the chat, and that will help you figure out which programs you are eligible for, and that will be a helpful tool for anyone asking if they're eligible or not. Next question, Jenny asks, are the grant funds subject to taxation?
They're not, but we highly recommend that you do speak to a tax advisor just to make sure you speak with them regarding any changes with the income, but they are not taxed.
All right, next question. There's a typo here, but I think this is saying, are you required to be enrolled in the MAT medication assisted program in order to be considered for SLRP?
No, the only requirements are the requirements that are on the grant guide, which were, and I reviewed them, but yeah, the main ones is that you're licensed, you have eligible loans, and then a few other questions regarding employment. But no, you do not have to be enrolled.
Just to step in for some clarity there, that question is asked as a supplemental question used to determine funding eligibility, but not eligibility for the award overall. So no, it's not a requirement.
Thank you. Julie asks, so is there a grant for only 1 year to fulfill or all of them for 2 years?
If you are a new grantee, it will be a 2-year obligation. The continuation grants are typically 1 year.
All right. Amanda asks, what if you go on maternity leave during the service contract?
If you plan on going on maternity leave, we just ask that you notify us. Just notify us when you plan on starting your leave and when you expect to return. Assuming that it would be longer than the 35 days that you're allowed to miss, we would then go ahead and add the days that you missed and then add that to your contract, which would extend your contract out by how many days you missed during the leave.
All right. When will you know if you will get a grant? How is the application or how is the amount determined? Did you have something to say on the previous question before?
Me? No, but I can step in on this one.
Okay, sorry, I thought you would raise your hand.
No, sorry, no worries. So we will make our award determination notifications. We shoot for December. Is our target date, typically late December. The grant award amount is determined by a few factors, including your overall score, fund availability, the number of eligible applicants we get and their scores, and of course your maximum eligible debt. You know, as Daniela pointed out earlier, the maximum award amount for, say, a new 2-year grant agreement is $50,000. But if you only have $30,000 in eligible debt, that's we'll actually award you a maximum of a bit less than that to compensate for any payments you may have made between the time of the application and the time the grant agreement starts. But the point is that the maximum award amount is limited by your eligible debt.
All right, thank you, Nathaniel. AJ asks, do most states have the same requirements?
As far as these requirements, we're only speaking for the state loan repayment program. There are other programs, as Chris mentioned, that you can check the eligibility quiz for. But as far as HCAI, these are for California. These are Californian programs.
If you're asking about the state loan repayment program for other states, because other states do have, you know, they have their federally funded state loan repayment programs as well. Most of these requirements carry over between state to state because most of these requirements are set on the federal level. But you would have to contact different states for their specific requirements.
All right. And as you can see, we did repost all of the resource links there. Make sure you take a look at those. Let's see. Next question. Sam asks, what is a Data 2000 waiver?
That is actually related to the medication assisted program. Again, that is a supplemental question used to determine funding eligibility, but not eligibility for an award. We don't ask you to upload that, but it's basically used to determine if you qualify to prescribe and dispense certain medications. I forget which off the top of my head. But it's just a question we ask to determine funding eligibility. It's not a requirement for the award.
All right. Next question. How is the grant paid? Is it paid directly to the lender or to the applicant?
So if you're chosen to participate in the SLRP, we'll be sending the check, the award amount, directly to the applicant. It will be then your responsibility to make sure that you use the award given to you towards your lender, towards your loans, your eligible loans. At the end of your contract, we will then be asking for your lender statement showing the payment history that you did pay at least as much as you were awarded into your loans to verify.
All right. Next question. I am an IHSS worker and I just finished my psychiatric mental health nurse practitioner. What are my loan repayment options?
So if you're wondering which programs you may be eligible for, you may go ahead and apply to the SLRP. We also suggest that you do take that eligibility quiz to see what other programs you may apply to. As I mentioned earlier, we do highly recommend that you guys apply to as many programs HCAI offers that you're eligible for. As a reminder, you can only accept one award. So if you're offered more than one, you'll have to choose one to participate in.
All right, next question. Sarah asks, does receiving another HCAI grant, for example, the Behavioral Health Programs grant, while you were a student, prohibit you from applying to this loan repayment program for the loan repayment grant?
As long as you do not currently have a service obligation and you're not under contract with them currently, that will not affect your ability to apply for this program. But if you are currently still fulfilling their service obligation, you would not be able to participate in the SLRP at this time.
All right. Let's see. Next question. How often is this grant offered? Is this once a year or depends on funding for the program?
Once a year. We hope to do it again next year. Plan is next year. You can apply as much as you want, as long as you're not currently fulfilling the service obligation.
Okay, next question. If we sell birth control, prenatals, etc., are we considered participating in reproductive health or not necessarily?
Not necessarily. The selling and dispensing of medication isn't necessarily participating in reproductive health for the purpose of this question. But do note that this question is another one of those questions that's more about determining funding eligibility and not award eligibility. Your answer to this question will not impact your overall application score or our award decision.
Right. Next question. Are general dentists working in FQHC facilities eligible, or only pediatric dentists can apply to SLRP?
No, yeah, general dentists may apply to the SLRP.
Okay. G asks, what is the timeline it takes for us to know that we got accepted for the application?
We're planning on notifying applicants in December.
Okay. Jenny asks, can service be started at one qualifying site and then be completed at another qualifying site? For example, change in employment from one FQHC to another.
Yes, you may go ahead, you may move sites. You just need to let us know within 30 calendar days if you are planning on making any changes to your practice site. We will have to verify that the site is eligible prior to you moving. So communication is just really important with this program, that you let us know. If you're planning on changing sites, we'll verify that the site is eligible, and then we will amend your contract to go ahead and display the new practice site you're working at.
All right, a couple questions on the logistics for money. First one we touched on is the $50,000 set to our banks or set directly to the loan servicer, and then the second one is the grant one payment or will be divided into payments every month. Also, if there is more than one lender, where would the grant money go first?
So to answer the first question, the award is sent directly to the grantee. It will then be the grantee's responsibility to then put the award given into the qualified loans that were put in the application at the time that were qualified. The second question regarding how many payments, if you're a new grantee, you'll be receiving 2 payments, one about 6 months after your contract start date, pending deliverables requested at the time. And the second and final one will be given 6 months after the first one. If you are a continuation grantee, you will receive just the whole award about 6 months after your contract start date, pending deliverables requested at that time.
All right, thank you. Let's see. Next question. Ignacio asks, if you work as an...
Sorry, Chris. We
you're
missed
good.
the question about more than one lender.
Oh,
And to answer that, that's up to you as the grantee. You have one or more eligible loans you listed on your application. At the end of your service obligation, we will ask for evidence that you paid your full award amount towards your eligible loans. How you choose to divide that up between multiple eligible loans is entirely up to you. We just need to see that you did it.
perfect. Thank you, Nathaniel. All right. Next question. If you work as an ER nurse practitioner in a government hospital, would this program cover you, or is there a different program for that?
The SLRP, you would just have to make sure that that hospital fulfills the SLRP practice site requirements. If they do not, we recommend that you go ahead and take the eligibility quiz and see if there may be other programs you're eligible for that may potentially allow you to work at that hospital. It would just depend. If you're not sure, feel free to email us with the practice site address, and we can let you know if your practice site is eligible.
All right. Next question. Hi, I'm a DACA student who just got into a nurse practitioner program. I believe I heard that you have to be a U.S. citizen in order to qualify for this program. Is this correct, or am I eligible to apply as a DACA student?
Yes, you do have to be a U.S. citizen, either born or naturalized. So if you are not, unfortunately, you aren't eligible for this program at this time.
Sarah asks, only primary care NPs are listed, but psychiatric nurse specialists are also listed. Am I doing a psychiatric and mental health NP or the PMHNP degree? Does that apply?
Yeah, that shouldn't be a problem. We do ask on the application, if you are a nurse practitioner, we ask to specify whether you are primary care or mental health care. That sounds like something that would fall under the domain of mental health care nurse practitioner, just as long as it's, licensed and not an associate position, shouldn't be a problem.
All right. Zach asks, after reading the grant guide, it appears that the required direct service for a LCSW is 32 hours. In the presentation today, it sounded as though for mental health, the direct service hour requirement is 21 hours. Can you please clarify?
Yes. So as I mentioned, for a couple disciplines, you may work 21 hours. You will have to provide 21 hours of direct patient care instead. That does include the mental and behavioral health care providers. So that would be 21 hours of direct patient care. But if you are going to be working as a full-time, you do need to make sure you are working a minimum of 40 hours.
And just to add, we can double check the grant guide on the website, but the copy I'm looking at right now does contain that information, that it's 21 hours per week for mental and behavioral health care providers. So.
All right. Next question. Will you be looking at the loan principal only and not the interest accrued?
That is correct. We will only be looking at the outstanding principal balance on your loans.
All right. Next question is it okay if we still have not 2 years in an FQHC facility as long as we commit to a 2-year stay at the facility, or we have to wait until our 2 years is finished first and then apply?
So we are only looking, when you accept an SLRP award and the associated service obligation, that service obligation starts at the beginning of the contract. We do not look at past service in eligible sites as any form of fulfillment towards that service obligation. That said, previous experience in eligible sites, FQHCs and HIPSAs, is a scored metric for the application. And so you do get more points for having spent more time there before applying. So short answer, you do not have to wait until you've been in FQHC for 2 years before you apply, but it does help your score, and then your obligation will start once the contract starts.
All right. Thank you for that clarification. This grant only for a doctorate? Again, we got I think a typo here. Doctorate or NP, or can it be for ADN associates trying to apply to a school?
You have to be currently licensed, so associate associate disciplines are not eligible for the program at this time.
All right. Let's see. Next one. Can you kindly share again how we can check to see if a place or address of employment is suitable for the SLRP?
So in the chat, they did provide the HRSA site, which does provide some guidance regarding if your practice site may be eligible regarding the FQHC. But we do highly recommend you can send us an email with the full practice site address, and we can notify you, letting you know if the site is in a HPSA or FQHC.
All right. Alina asks, our company was awarded with the Community-Based Organization Behavioral Health Workforce Grant Program, and part of the program we are offering loan repayment program. Will California State Loan Repayment Program application would be the right way to apply for and be a part of the grant?
No, I don't think so. The SLRP is its own program, and it sounds like your organization was awarded an award from something else and is using that in part to offer a loan repayment program. So you'll want to work with your company or your organization to determine the best way to apply for that. But it sounds completely separate from the SLRP.
Next question. Can I apply to the county medical service program, loan repayment program, if I get awarded this grant? Let's say I do not $50K from this grant. I would like to take advantage of the other sources to pay all my loans.
You can apply, but you would just need to verify that there is not going to be a conflict in the service obligations. That would require that you verify how long the contract is for. If you're applying as a new grantee, it will be for 2 years. So you wouldn't be able to apply this year, as most of the program start date begin next year. So you would still be in the SLRP program. But if you are applying as a continuation and your contract will end next year, you may potentially apply to more programs. Just notify us ahead of time if you want to verify that there will not be a conflict of interest.
All right. Thank you, Daniela. Sam asks, if you answer no on whether we hold a Data 2000 and we answer no on a supplementary question such as holding a substance use disorder certificate, would that affect the amount we get awarded? Would we get awarded a lesser amount for answering no on any of those supplementary questions?
Not necessarily. Again, all those supplementary questions are intended only to confirm your eligibility for different funding pools. They do not have any impact on whether or not you get an award in the first place. When we make our award determinations, we are looking at your application score. So if you have any questions about which application questions impact that, I would encourage you to take a look at our grant guide, where we do have a scoring breakdown for the application. The questions asked, the possible answers, and the possible points. But all those supplementary ones, they're not scored. They are just there to help us kind of guide which funding we pull your award from. So.
All right. Brian, skipped a question. Julie asks, once awarded and notified in December, will the grant start in December or be pushed off to a later month for the start date?
No, the contract should begin in spring of 2025. So we will notify you that you are chosen to participate in the SLRP. You will then go ahead and accept or deny, and then we would then start getting the contract in place with your start date. So we will notify you ahead of time when your start date will begin, but it will not begin in December.
All right. Sam asks, after submitting the initial application online, is there anything else we need to do?
Nope. We will go ahead. We are reviewing applications as they come in. If there's any corrections needed, we will notify you. So just look out for that email. If there are no corrections, we will also let you know that there is nothing else needed from you regarding the application. So yeah, as long as once you apply, we will notify you if we require additional information.
Okay.
Sorry, Chris, it looks like we missed a question from Brian regarding refinance student loans.
Oh, you're right, we did. Thank you. If we have refinanced my student loans from federal government to private lender, can I still apply?
And now we got to come back to that because the answer is no. refinanced loans that have become private are not eligible for the program in any capacity.
All righty. And then let's see here. Will the SLRP committee review the loans in the application and verify if they are eligible? Will there back and forth communications to clear up any questions?
Yes, we will be reviewing the application, your lenders, your loans, just to make sure they are eligible. As I mentioned earlier, if there are any corrections needed, we will give you the opportunity to make corrections. If the loans aren't eligible, and if they're private, there's most likely not much you can do, but we will give you the opportunity to ask any questions and provide us with further information.
Okay. Requirements say that you should not have any other obligations or not be under any breach. If someone has an unpaid private personal loan, which has nothing to do with his student loans, does that affect anything?
No, it does not.
All right. Thank you for all the information. Is there transparency on what the amount of money is available for this program? Is this public knowledge?
We have base funding available for, totaling 1,333,000. Other funding is pulled from other sources as available. And so while we can make the funding sources public knowledge, we don't necessarily have the ability to advertise how much money we have from each pool, as these pools are often shared across multiple HCAI programs.
All right, next question. Do I qualify if I currently have a PSLF?
Yes, yeah. Just let us know if your loans are forgiven after you receive the award for the SLRP. Just notify us immediately, but you may still apply.
All right. If you signed an offer letter for a position at a FQHC, but are awaiting credentialing with insurances, therefore no specific start date yet, but anticipation to start by September, can you still apply? How would the site complete the EVF?
Yeah, so as long as you do have a current offer, if you could provide us with an estimated start date, and that's where the EVF will be important, that your site administrator does fill out the EVF with how your hours will look like. They will also verify that you will begin working. So you can still, as long as you do have an offer that you have accepted.
All right, next question. Where can we find a list of sites that are eligible for SLRP for psych nurse practitioner?
Since some no match cycle, there isn't a list of eligible sites. You'll just have to verify that it is eligible under the requirements, which you can find in the SLRP grant guide, or you can email us at the SLRP inbox regarding questions, and we'll be happy to help you out with that.
All right, so confirmation of the dates involved. So decision in December 2024, and then the grant's first payment will be awarded in June 2025. Then second installment is December 25, and it would be 25K plus 25K.
No, not necessarily. So it will be, if you're a new grantee, it'll be 6 months from your start date, your contract start date. So it's if your contract begins the 1st of May, we'll be asking you for an EVF 6 months after your contract start date. Once we receive your EVF, we will then begin to process your payment. You'll receive the first installment 6 months from then, and then the second one 6 months after you receive the first one. And it depends on how much you're awarded. We will be sending you the check. It's 80-20, 80% is your first installment of the award, 20% will be the second.
Right. I owe $62,000 on one of my loans, but my statement only says $42K. That is because 2 loans are not in payment yet. Can I supply the loan summary page along with the statement so SLRP knows what I actually owe?
Yeah, go ahead and just provide us with your lender statement, and we will go ahead and review that. As mentioned, we will be seeing what the outstanding principal balance is.
Right. And got two questions here. Clarification on what the EVF is, or EVF.
That's an employment verification form. We will be requesting that you provide us one with your application. That will need to be signed by yourself and the site administrator, verifying the hours worked and verifying your practice site.
Right. And then the second one, what is the direct email or phone number to contact you guys?
Yeah, we'll be providing that to you. I believe it's on the next page, but the email is slrp@hcai.ca.gov. You can also find all the contact information on the site, the SLRP site.
Okay. Looks like Marwan's internet cut out and missed the answer for the date plus the installments, the way the installments go.
No, it doesn't. You won't necessarily get it in June. You'll be getting the award. If you are chosen to participate, you will be getting the award 6 months from your contract start date. Pending deliverables requested at the time. So 6 months after your contract start date, we'll be requesting your first EVF. Upon review of your EVF, we will then begin to process your first payment, which will be for, if you're a new grantee, which will be for 80% of the award. And then the second payment will be distributed 6 months after your first payment. Which same process will be requesting the EVF. Upon review, we will then go ahead and send over the final installment of the award payment. And it's not necessarily, so yeah, it's not 25,000 then 25,000. And it also depends on how much you are awarded as well.
All right, thank you, Daniela. And we are coming up towards the end of the webinar, so if you have any more questions, make sure you get those into the chat now. The last question I've got here right now, where will this webinar be available? You can find it right now in the chat. You can see all of our resource links, which include the slide deck for this webinar is already available on our website. And then we are recording this webinar and we will be posting it to the SLRP website within 7 to 10 business days. And give 30 more seconds for anybody to get any questions out. Here's a good one. What percentage of applicants are awarded a grant?
Nathaniel, do you know the
Yeah, there isn't a hard percentage. And it's even hard to give a historical record because we've had varying amounts of available funding and various numbers of applicants every year. So I can't give you a hard percentage on the number of people who get awarded. I can just say it's a fairly competitive program. And unfortunately, that's all I can provide in terms of that answer.
All right. Well, again, if your question wasn't answered, please email us at slrp@hci.ca.gov, and the team would be happy to get back to you and answer all of your questions. Thank you all for your participation in the Q&A session. Great questions as always. One of the reasons why we do these webinars is to answer your questions. And so if you didn't get it, please get those emails into slrp@hci.ca.gov. And then as a reminder, we will be posting the recording of this webinar, and the slide deck is already there on our website in 7 to 10 business days. We do appreciate everybody joining today to learn more about the California State Loan Repayment Program. We're excited to be able to offer it as a part of our health workforce development efforts at HCAI and are grateful for your participation with us today. One of the things we'd love for you to do is sign up for a newsletter, and you can go to this link at the top of this slide here. and sign up for our monthly newsletter, and you will stay up to date on all of the offerings that HCAI has. And it's a great way to know what is going on, funding cycles and all of that. You can also contact us through phone 916-326-3700, or again, slrp@hci.ca.gov. And we do encourage you to go to our website to discover all of the great resources that HCAI offers. And lastly, as a reminder, the application cycle closes on September 16th at 3 p.m. So make sure you get your applications in before then. There's some great ways to stay in touch with us on social media. And with that, thank you so much for attending. We conclude today's webinar. Have a wonderful day.